chairmanship, and it is truly wonderful to be back with Westminster Hall debates. And before I respond to the various points made by honourable members, I just want to thank the honourable member for Hammersmith for his collegiate way in both highlighting some of the concerns, but also in working together to address them. And of course, for raising the issue of COVID vaccinations in London, which is at the forefront of many Londoners' minds. It is worth reminding ourselves, Christopher, where we were at the turn of the year before the vaccine rollout really gathered pace. In early January, we were seeing over 50,000 new cases of COVID and around 4,500 people admitted to hospital every day. Sadly, we were seeing over 1,000 deaths every day. In London alone, there were over 1,100 deaths a week. Each one of those deaths was a grandmother, a grandfather, mother, or father, daughter, or son, or in my case, an uncle. Each of them desperately missed by their families. We cannot obviously prevent every death, but what we are on is the road to making sure such tragedies are less commonplace. Recent Public Health England data show levels of antibodies against COVID-19 are highest in the over 80s, the first group to be vaccinated. It also tells us that a single dose of either the Oxford or the Pfizer vaccine delivers protection against severe infection in the over 70s, with a more than 80% reduction in hospitalisation. The vaccine is working and is having a real impact, protecting the NHS, protecting individuals, and putting us in the right track out of this pandemic. I'm pleased to see that enthusiasm for vaccination is still incredibly high, rising, in fact, week on week. When I took on this job, it was sort of in the late 70s in the adult population. Now it's 94% saying they would be willing to have the jab. I've read glowing words from people who've received the vaccine in the honourable member's own constituency. Doris Sargent, 90-year-old former hairdresser who was determined to get the vaccine to make sure she can see her family once lockdown is eased, or Jan Keith, from whom the vaccine means hope for reintegration into a better quality of life after almost a year of shielding alone. These stories are replicated many times across London and the rest of the country, and I'm determined that we will continue to hear more of these personal triumphs over the forthcoming weeks and months, Sir Christopher, of the rollout. On the 22nd of February, the Prime Minister set out the new targets for the acceleration of the programme. We set an ambitious aim to offer all adults over 50 a first dose by mid-April, and the rest of the adult population by the end of July. And I want to reassure honourable members that we are on track to meet those targets. Although obviously day-to-day figures for vaccine supply do vary, and we have a few days better than others overall, we are working towards accelerating the pace of the rollout, as many honourable members have indicated, with some bumper weeks ahead from the middle of this month, allowing us to really ramp up vaccination over the month of March. I know honourable members have raised the issue of uptake rates in London and vaccine hesitancy, and I'm concerned about uptake in the BAME communities. That is why I spent a great deal of my time, Sir Christopher, talking to community leaders about how we can reassure people about the safety and efficacy of the vaccine. On the 13th of February, we published our COVID-19 vaccine uptake strategy, which aims to improve uptake across all communities. Very much a strategy that was developed by our NHS, backed by the department and, of course, local government. The plan takes a local community-led approach with support provided from government, NHS England, of course, local authorities to coordinate and enable action. It includes engagement at local level using trusted voices, sharing examples of what is known to work well in nearby areas, and encouraging community-led efforts to address vaccine disinformation. We are absolutely committed to providing advice and information at every possible opportunity to support those getting the vaccine, and to anyone who might have questions about the vaccination process. Through the Community Champions scheme, which was mentioned earlier, councils and voluntary organisations will deliver a wide range of measures to protect those most at risk. They are building trust, communicating accurate health information, and ultimately helping to save lives. This will include developing new networks of trusted local champions where they do not already exist. And the funding is specifically targeted at areas with plans to reach groups such as older people, disabled people, and people from ethnic minority backgrounds. And according to the latest evidence, these individuals are more likely to suffer long-term impacts, as we've heard from colleagues, and poor outcomes from Covid-19. We've put £23 million to work on this in 60 local areas. In terms of vaccine supply to London, honourable members have raised this issue of vaccine supplies in London and how this is managed at a local level. Firstly, I just want to reassure our honourable members that our supply and scheduled deliveries of vaccines will fully support the vaccination of the priorities that the JCVI, the Joint Committee on Vaccination and Immunisation, have set us 1 to 9 by mid-April. The UK has secured access to 8 now different possible vaccines across 4 different vaccine types, reflecting our strategy to ensure that not only do we deliver the vaccines now, but also future-proof any vaccination programme, a booster or an annual vaccination programme in years to come. Parts of the country have made very significant progress, as we've heard, and gone faster than the average. We are putting more supply into areas, and I want to reassure colleagues here that have to do more, with the NHS doing really brilliantly to deliver the amount of supply we have. London vaccine allocation is now managed at a London regional level, and prioritisation is based on the uptake data, and it is decided at a system level where the vaccine is most needed and using which delivery methods. So pop-up sites we've heard about, roving models are also used to take the vaccine to underserved communities, which we've heard so much about. Colleagues have been very supportive, and we've had an MP's toolkit to support the vaccination effort in their areas, and that's done incredibly well. But before I finish, I just want to address some of the more specific points raised by the Honourable Member for Hammersmith and others. The Member for Hammersmith raised the issue of the Novotel opening next week. I can confirm to him here today that it is opening next week, that vaccination centre. There are 200 sites across London that are now vaccinating, and I know some people have issues around travel, but I know also Age UK, for example, some brilliant charities have come forward to offer free travel for the over 50s to get them to vaccination sites. The member for Westminster North raised a very specific point around the issue of the confusion of data between ONS and the NIMS data. I just would sort of point out to her that on occasion, double counting, because ONS data is purely age-based, so at-risk people or workforce in care homes will be double counted in that data. The NIMS data is more accurate, but for the sake of full transparency, the NHS have made both data sets available. The member for Harrow East raised the issue very specifically of vaccine supply, and I can reassure him that we are about to see a massive step change in vaccine supply to his constituency, and of course to make sure that we don't make them a mistake, as he quite rightly was warning us in terms of second doses, and I can assure him of that, and I will take another look at his specific point around the mass vax centre closures. The member for Ealing Central and Acton raised a number of issues, again, around specifically Acton town, and I will take those up with her. And the member for Enfield North talked about unregistered people. They can actually register any GP practice because we have amended the contracts to allow GPs to take on more people who are unregistered, including, of course, those who are undocumented, who have the ability to be vaccinated, because we want everyone to be protected. The member for Hornsey and Wood Green, again, raised a number of issues about health inequalities. It is a standing agenda item daily in our ops meetings in the deployment programme around health equalities, and the strategy I mentioned earlier is very much part of that we launched on the 13th of February. The member for Bethnal Green and Bow raised a very important issue around Ramadan and the use of mosques, and I was at the Brent Mosque last week to see how brilliantly they were doing by really getting into the community. And I would just remind colleagues that Dr. Habib Naqvi said that actually the contents of the vaccines are halal, and there is no reason it would not invalidate your fast if you are to be vaccinated in Ramadan. With the honourable member needing to just close the debate, I will probably end there, and I will just say finally, Sir Christopher, is just to read out one quote from the Director of Public Health for Newham Council, who last week said, and this sums up the collaboration, the partnership, over 50,000 Newham have now vaccinated. Long way to go, but real progress. All 60 plus can book online. Plus this week, pop-up clinics at Sri Murugan Temple, Minaj al-Quran, Ranahengra Centre, Redeemed Christian Church of God, East Ham Leisure Centre and Homeless Clinic. Real partnership. That is what we are doing. That is what I am determined to deliver for those communities. No one will be left behind. And I'm grateful to colleagues for this very important debate. Thank you very much indeed.
Andy Slaughter.
Thank you, Sir Christopher. Thank you for your stewardship.